To infinity and beyond. 1 year ago today, Michael Saldivar was so excited to trick-or-treat with his son, Rocco, for the first time, who was dressed as Buzz Lightyear. But after Michael fell asleep on Halloween Eve, his heart stopped. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. And I'm smiling today because this story does have a happy ending. But imagine this, you're in what you think is the best shape of your life. Your wife is pregnant with your first child. Life is great, right? For Michael Saldivar, though, that's when the bottom fell out. He was diagnosed with heart failure at only 30.
Where's the slide?
Yeah.
He is fascinated with his books.
Keep going, Rocco.
His bike.
He loves it. He shreds on it, actually.
His toys. And sometimes our camera. Rocco, who is on the cusp of turning 2 years old, is about as happy, active, and loved as any little boy could be. And as the fall holidays approach, particularly Halloween, his parents, Katie and Michael Saldivar, are looking forward to a do-over.
We missed Halloween with him last year.
So bummed because his costume was so sick.
What this young dad didn't realize as he drifted off to sleep on October 30th, 2024, was how sick in a bad way he was getting.
The worst thing is probably that's ever happened to me, 100%. Scary, I mean, you know.
The last thing Michael remembers is Rocco crying in the middle of the night and Katie going to the nursery to check on him. That's when Katie heard a strange sound from their bedroom.
Katie says she heard kind of a thump, and it was like my defibrillator going off.
A defibrillator Michael had gotten implanted at the University of Kansas Health System a year earlier after his first health scare.
It was kind of just a normal day. I did my lifts. Later on the afternoon, I rode my mountain bike, cut in the yard, and I was taking the dogs out. And as I was going to head out the door, I went into the bathroom, and I kind of just it was kind of like I blacked out.
That's when his cardiology team at the health system gave Michael some stunning news.
Heart failure, I had an enlarged heart.
Michael was diagnosed with heart failure. He was only 30 years old. He wasn't sick enough to go on the transplant list, so doctors put him on medication and ultimately implanted a defibrillator just in case. 1 year later, the just in case had just happened. The defibrillator had just saved his life. Michael was rushed again to the hospital and this time immediately placed on the heart transplant list. He would not have a long wait.
I collapsed on the 31st and then got a heart transplant on the 22nd.
The first thing he remembers after waking up from surgery was how different he felt.
When I woke up, my heart was thumping. I was shaking, you know, my whole body was shaking. I was talking to somebody and they were like, yeah, this is actually what a heart feels like. My eyes were like pulsing, and I was just like moving, and it was like, this is like wild.
Because he didn't have anything to compare it to, Michael didn't know what a healthy heart should feel like. While he wasn't home by Thanksgiving, he was home in plenty of time for Christmas with his family. And these days, everything is about family. His wife and Rocco are the center of his universe.
He really is my motivation, right? Being able to know I have more time. I feel like for me, it took a lot to realize how lucky I was. I try as hard as I can now to prioritize, knowing how fragile time is. Whoa, you're so fast, go, go, go.
And this Halloween, they're planning for all treats, no tricks.
You gonna go towards the camera?
And most importantly, they'll all be together.
You can find blessings in anything. Every morning I woke up, I'm like, dude, another day. I'm hyped.
Now for the good stuff. Check this out. We have Michael and Rocco in the studio with us today. Hey, Rocco.
Can you say hi?
So what are you for Halloween?
I'm a dinosaur.
I know.
I don't know what type of dinosaur though.
It's pretty amazing. The only kiddo who gets to debut his costume on TV. Thanks for being here, and thanks for bringing Rocco. How are you feeling today?
I feel great. I feel great, and I feel lucky. And it's obviously really great to see kind of the A team here with me too. Yep.
That's right. And we're going to get into what these guys did to save your life in a little bit. And we also have your lovely wife, Katie, in the sidelines. Just in case Rocco gets bored with us, bored with the conversation, he can trot on over to Katie. We are also joined by two of Michael's thoracic surgeons. We have Dr. Matthew Danter, Dr. Tyler Zorn, and we have one of Michael's heart failure and transplantation cardiologist, Dr. Hirik Shah, who's joining us in the studio as well. Thank you for being here.
Thank you.
We are so. What's it like to be next to this guy again under these circumstances?
It's great. I mean, just seeing where he was and to where he is now, and seeing that segment. I mean, it's incredibly emotional. And thanks for coming.
Michael has a lot to live for, a lot of life to give. Michael, tonight marks 1 year since your cardiac arrest. What do you remember from that night? Katie remembers hearing the thump. Mm-hmm. What about you?
Yeah, I mean, it was one of those things where, you know, I was kind of in the back seat. You know, I didn't really realize what happened. I think the biggest thing was falling asleep and waking up, trying to get out of this dream. It was kind of like trying to get out of a dream that you can't wake up. It's like, hey, I know I'm asleep, and then just hearing my wife's voice and just trying to find her. So that was like, you know, after that, realizing that, you know, this is you know what actually happened, and I think I really came to terms with, I'm ready for the transplant. Mm-hmm. That was it.
It was on its way. Dr. Shah, the defibrillator had to shock him twice. Is that the case, and is that typical?
Usually not, and I think that's a sign of a heart that's really, really sick.
Right.
And a heart that is struggling. And the good thing is the technology that we have in these defibrillators are really, really good, that it anticipates that. And so if the first shock doesn't work, they have an algorithm where they would do another shock, usually at a higher energy or a different vector. And so the technology that he had in place, you know, did its job. But the fact that he had to get shocked twice already puts our alert level really, really high that this heart is struggling, and we need to do something about it.
Is it always audible? I mean, Katie heard a big thump from the other room.
And so when a device shocks you, there's an alert that, well, the thump can be audible, then afterwards there is a ringing that the ICD delivers, that so people know that something occurred, so then it alerts people, because sometimes people pass out and they don't know. And they actually never felt it because they passed out before they shocked. And so that alerts that something did happen, and so then to get checked out.
Michael, were you ever able to unravel why you had heart failure at age 30? That is so young.
No. Zubair Shah, he's like, I saw him walking on the halls, and he's like, yeah, I have your heart and I'm studying it right now. It's just kind of hilarious. It's like, all right, you know, it's the weird thing. But no, they tested me for genetics and nothing really came up. And then it kind of correlates to a time that I got sick when I was really young, just with how enlarged my heart was. So.
And Dr. Zubair Shah is another one of Michael's doctors who couldn't be here this morning, but he's amazing. You had 4 incredible doctors among this huge team working to save you. Dr. Danter, you're the surgical director of transplant and mechanical circulatory support here at the health system. I don't even want to see your business card if you have it. It wouldn't even fit there.
I don't.
You play something, you don't?
No.
You speak for yourself.
Right.
You play something called an Impella device in, Michael. How is Impella different than a traditional LVAD?
Well, technically speaking, it is an LVAD. What it would be classified as is a temporary circulatory support device. So this is a device that, when people are in shock, we utilize it to support their circulation to get to the next step. And sometimes when people come in, we don't really know which direction we're going to go, or in Michael's case, we don't know how long we're going to have to wait for an organ to become available. So this is an additional support device that helps support a circulation, get you out of shock while you can wait for a transplant.
So it's another kind of a bridge to transplant.
It's typically used as a bridge to transplant device, yes, or a bridge to recovery device in circumstances where we're hoping people will have their own native heart recover.
Dr. Zorn, we've been in the room when you're doing a heart transplant, which is so cool. We've seen the process of taking the heart with the LVAD attached to it. Is that different versus when there's an Impella in there?
No, I mean, it's easier.
It's
for
easier,
sure,
okay.
because nobody, when you put an Impella in, nobody's been in the chest, operating, mucking around in there. So when somebody puts an LVAD in, you're going, into the chest. You're putting it directly on the heart, sewing it to the aorta. So when you have to take that out, there's a lot of scar tissue that you have to work through to get that heart out. For Michael, it was, what we call is a virgin chest, or nobody that's been there before, and so easy to get in and easy to take the heart and that pump out.
So you were able to quickly put the Impella in when he came in waiting for his transplant. How did you put it in then? It's not an open heart.
It goes through the axillary artery. So
Okay.
we sew a graft onto the axillary artery, and then we tunnel the graft out, and through that we essentially wire this device, which is essentially an Archimedes screw that impels blood out of the heart into the aorta.
Okay. What's it like hearing all this talk about your heart?
Oh.
Like you're a specimen.
Yeah. I think it's fascinating now for
Right.
sure. When the Impella did go in, I noticed immediate. I was so much warmer. And,
interesting.
And things were just working a lot better, which honestly was kind of exciting because that's like the first time I realized that, it's like, hey, like this is something better.
This is how it should be,
Yeah,
not what you
yeah,
were feeling
yeah.
before. You also had a really wonderful relationship with your nurses, but you have a way of connecting with people, and so they talk to you in such a comfortable way. You shared a conversation that Michael shared a conversation he had with his nurses while he was in the hospital, so take a listen.
I remember one of the nurses was like, dude, you should see how big your heart is. Like, just very casual. Like, I'm sure they run into stuff all the time, and they love that stuff. And
Did they really call you dude? Dude.
I think my vocabulary is out the door. But yeah.
Dude, you should see your heart.
Yeah, I think they might have actually said dude at that time.
Because it was so big.
Yeah.
Well, how big was it when you take it out?
I mean, so we take out hearts that are big every day, but when you look at Michael's old CT scan or his old echo, I mean, his heart's literally taking up his whole left chest. And this had been going on for a while. We were hopeful, initially when we saw him, we knew his heart was big, we knew his ejection fraction was very low, but he was, like you were saying before, playing basketball, still doing all the things that he loves, and so we were hopeful that, meds would be able to control this, get him feeling better, get his ejection fraction up and his heart size
So like a normal
lower,
heart size of a fist?
Yeah, fist.
What's his?
His was
It's
like
so
that child's basketball, that
Holy
you play
smokes.
with. So, I mean, it was big even in comparison to the big hearts we normally throw in the trash.
So they had reason to say, dude.
Yeah.
Dude. Dr. Shaw, what are the benchmarks that a patient needs to hit before they qualify for a transplant? You mentioned that the 2 shocks from the defibrillator was a major sign.
Mm-hmm. Yeah, and that's a complicated question because there's so many factors, and we have a big multidisciplinary team that tries to answer the question of candidacy for heart transplantation. I think the first question is the heart truly sick enough? And we knew his heart was really, really sick, like Dr. Zorn mentioned, but because he was so young, he was able to compensate for that sick heart. The rest of his body was still a 30-year-old, and so even though his heart was incredibly enlarged, he was able to do things that other people could do. I think it speaks to how healthy he otherwise was. But then over time, the body does succumb to a bad heart, and one of those signs could be progressive heart failure, more shortness of breath, more fatigue, or it could be signs of ventricular arrhythmias where the heart just goes out of rhythm. And I think probably both were happening, but the arrhythmias were kind of the big aha moment that, okay, the time for medicines is done and we need to move forward to a more definitive pathway.
So how much time, Dr. Danter, passed between Michael coming in it was Halloween morning by the time when he got here, how much time passed between that and him getting the heart?
I don't particularly remember. I think that's probably more a question for Dr. Zorn because he did the transplant.
Yeah,
So
they're about a few weeks. So I think it was like the 22nd of November.
Yeah.
So of all the heart transplant surgeries you do, what percentage is as young as Michael, 30 and younger?
I don't know, what did you say, 10, 15%?
Yeah, 10,
pretty rare.
15%, yeah.
And are they typically men or women?
Both.
it varies.
Both.
Yeah.
But young is the factor that made this pretty unique.
Yeah, unfortunately, young people get bad things that happen to them. So it's
And such an active
usually-
guy. Did the fact that he was in such good shape, Dr. Shaw, did that make it easier for him to recover from this?
Oh yeah, 100%. Yeah, I mean, the fact is that he had a one organ problem, which was his heart. Everything else was operational. Kidneys, liver, muscles, all operational. So once you kind of swap the bad heart for a good heart, everything works like a great machine, and I mean, he recovered very, very quickly.
Well,
Hearing
you
what he's
said-
doing right now, I mean,
Yeah.
yeah, probably could beat 2 of these people on this stage in basketball. Maybe not today.
That's 100% true. Yeah.
He was like building things, working in the yard, making things, running his production company. You've already challenged all these guys to basketball,
Well, challenge is a strong word.
like 1-on-3.
Yeah, 1-on-3.
I'll
No,
get there, too.
yeah.
When you woke up, it was striking how you said your heart was thumping, your eyes. It sounds cartoonish. Your eyes are pulsing. Is that normal, doctors, for someone to wake up and feel like a superhero?
It's quite impressive a lot of the time, because you'll see people that there's a change in their sort of just the color of their skin in terms of being perfused and being warm, and people go from being in shock that they've been in relatively for a long period of time and compensated, to the point where they're like pink and warm and feel really quite good. Like Dr. Shaw said, when the pump works and there's nothing else that's really wrong with them, people recover very quickly when you have a single system problem. So, Michael did great, and he's like a model patient and a wonderful ambassador for us,
He really is. How long did it take you for that to feel normal, that thumping and pulsing and blood coursing through your veins?
Yeah, that is a great question. I'm not quite sure. I feel like it was pretty a month, maybe. I don't know, maybe a month. For sure.
But when you would get out of bed, you feel like you could fly. You're just like, I am super strong. I can take on the world.
Yeah, I definitely felt like I could do more than my body could. Because you kind of have to recover. You have to get, just walking up the stairs was kind of a challenge. But it's kind of a fun challenge, because I can't sit still. So
You like a good
I
challenge.
like moving. Yeah.
What made this particular donor, and we can't talk to the specifics of who the donor was, a great match for Michael? Who wants to take that one?
Again, it was probably Dr. Zorn who reviewed that, but in general, when we're looking at organs, we look at, aside from the obvious things, or blood group and hemocompatibility, we look at size, gender, function, absence of any other sort of significant diseases. But specifically, I don't know, Tyler, what do you think?
Yeah. Size, age,
Then it was a match.
Make sure it's a heart that, as far as age goes, Michael's a young guy, so we're not going to take a heart for somebody in their 50s, for him.
Right.
So it's got
Had
to
to be
last a
someone
while.
young. Did you have to travel then to get that heart? What's that process look
I
like?
don't remember specifically where the heart was, but there's a few different ways it happens. Sometimes it can come from within your own institution, where it's just coming down the hallway. Sometimes it's a drive away within kind of the city limits, and then a lot of times, more times than not, we're getting on a plane, sending somebody from here. One of our retrieval surgeons, procurement surgeons, who's also a cardiac surgeon, to the donor hospital, where they will procure the heart, put it in a box, keep it cold, and then bring it back to us.
Is that sometimes you guys? You're getting on a plane, flying to escort a heart back to the hospital?
Tyler more than me, but no, typically it's one of our surgical partners who is on call, and it speaks to the fact that it takes a large number of people to get this to work, and we're very fortunate here that our surgical partners are always willing to go and travel, because it's very disruptive to their day, and it's usually the middle of the night, and it's all these kind of things. So the program itself requires a lot of support from a lot of people to be as productive as we are.
Yeah. We have some great questions and comments already coming in. So if you'd like us to read a comment out loud on the program, or ask the doctors or Michael a question, you can connect with us in real time. You can just send anything you want to say or ask to us on YouTube, Facebook, or the All Things Heart email, and you can find all the links right there on your screen. So Michael, as you're being wheeled into the surgery room, the nurses gave you your own walk-up song, like a baseball player going up to bat?
Oh, yeah.
What'd you pick?
Stronger by Kanye West.
Okay.
Yeah. It was probably the hardest decision. We spent all night looking for different songs and genres, and there's a lot of things that speak to you while you're in the hospital, right? That just felt right,
Is that blaring through the halls while you're getting wheeled on a gurney into your surgery? What does that look like?
I think they have it on the overhead speakers. They play it, and so it was pretty cool. It was really cool just because you develop relationships with like the nurses and nurse practitioners. So it's really cool to see everybody. And like, I felt pretty, I don't know, I felt excited, nervous and excited to do, what needed to be done. And I was like, I felt pretty good until I started seeing all the faces that have taking care of me. And, I've been in the hospital just for routine things to, if I gotten sick, people have come in. And anyway, so I've been here for about 2 years. So I've seen some of these people for 2 years. So it gets pretty emotional.
I imagine. Everybody. And then when it comes to his doctors, do all three of you need to be there in the hours after the transplant, or after the transplant is done, does the baton get passed to a whole different set of aftercare doctors and nurses?
We're sort of it's very much a team sport. So the advanced heart failure service rounds together with our ICU colleagues, and in the immediate postoperative period, it's really sort of the goal is maintenance of adequate hemodynamics, control of any sort of arrhythmias or anything that would impede the recovery. But it really transitions from the operating room to the ICU, but we are all there in some capacity or other every day at 8 a.m. to round on everybody that's in the advanced heart failure programs that's had surgery. So it's there's very good continuity there in terms of sort of the aftercare and the postoperative management, because it does take a team of different people with different insights and different experience to get everybody through successfully. So,
what are the main things that you and the team are looking for in just the first, let's just say, 5 hours after you put in a new heart?
Things that I look for, like adequate cardiac output. Is the heart delivering enough blood flow to the rest of the body to keep up with the other end organs? Are the kidneys happy? Is he making urine? Is he warm? Has he woken up from surgery neurologically intact? Are we working to get the breathing tube out? These things are really important. And to elaborate on Matt's point, I mean, the ICU team really starts to take over their care from the time they get to the ICU. We're certainly not off the hook, and we can't just leave the hospital right away. But they do a good job. They do a great job, and we do such a good volume here that they know really well how to take care of these patients. Do a phenomenal job. So.
And Dr. Shaw, what kinds of things do you prescribe Michael, including the rehab, and how soon does that process begin after he gets his new heart?
Yeah, the rehab happens pretty quickly. We try to take the breathing tube out fairly quickly and have physical therapy, occupational therapy work with the patients, trying to make sure they're not just staying in bed and trying to get active, start walking. You probably walked pretty soon right after your
yeah.
Like what soon? A day or a day?
It could be a day.
Usually a day after.
Is the breathing tube out after a day?
Yeah.
Wow. What do you remember first when you came to? What's your first clear memory after the surgery?
I was ecstatic. I was like, I made it. It's just kind of one of those things where it's like, just like we were on the other side of this.
Yeah.
So I worked hard to get that breathing tube off. I was trying to signal to my nurses to give me a piece of paper that says, hey, I'm ready for this thing to come out. Yeah, it's pretty funny. Actually, as soon as I got it out, I called my wife, which she was nervous because I was calling from the hospital phone. She's like,
"Oh, so just it comes up hospital calling?"
Yeah, she's like, we won't contact you unless something's going on, and it's like KU, man, which is hilarious.
Yeah.
So what did you say?
I don't know. I was just super. I was like, I don't even remember, honestly. I was just pretty ecstatic to. I'm sure she remembers exactly what I said.
I feel like when we interviewed you, you said something very benign, like, "Hey, it's Michael."
Yeah, sure, yeah.
How you doing?
Yeah.
It was something. I feel like you had relayed that kind of a conversation to us. Hey, what's up?
Yeah, I have really bad dry humor. Yeah, it's not great.
Oh my goodness. Yeah. Well, we have some viewer questions coming in, so I want to get to those. Jeremy Yenser wants to know, what kind of medication do you take after you get a heart transplant? Dr. Shaw.
Yeah, there's a variety of medications. The most important ones are the medicines to prevent rejection and to help suppress the immune system to prevent rejection. And so usually in the beginning, this well, are 3 medicines. Tacrolimus, mycophenolate, and steroids. And as we get further along the process, we're able to taper those down as the body kind of starts to form, a relationship with a new heart, and the risk of rejection is a little bit lower. There's infection medicines that we give for prophylaxis. So there's a whole cocktail of medicines, especially in those first 6 months, that he's taking in order to preserve that heart and preserve any of the complications that come from a heart transplantation.
At what point can he stop taking those medications?
Yeah, never.
Okay.
There are some that he will take forever. The tacrolimus and the mycophenolate are ones that we kind of keep on for forever. The prednisone comes off. At some point, the infection risk comes off. So the medicines do come down, but
Right.
he'll always be on some medicines that are related to his heart transplant for the rest of his life.
John has a question. This is a really good question. He wants to know if there's any kind of counselor who helps patients going through something huge manage the anxiety.
Yeah, I think speaks to the multidisciplinary aspect of this. I think the one thing that we do really well here at KU is we have a big team that works really, really well together. And so part of that team is a psychologist and a psychiatrist that
wonderful.
Evaluate the patient on the preoperative side, but then definitely help on the postoperative side, because patients are going back to life after a heart transplant. That's never an easy transition. And having someone that is part of our program that we can dedicate to our post-transplant and post-LVAD patients, I think is a really, really good addition that we've made, and I think is a great resource for patients like Michael and others that, because anxiety and all that is probably the norm, should be the norm
Oh, of course.
after this, after
Right.
such a big surgery.
You're nodding your head, yes, Michael. You've taken advantage of those.
Oh yeah,
services.
I mean the doc that I see, like, she was really helpful, especially after
Sure.
a few months. Yeah. So the support is there. As long as you want it to. I'm pretty sure. So yeah.
One of our viewers, Marie, wants to know, Michael, she asks, where were you when you were told you need a transplant now?
I think the initial conversation was my initial time meeting Dr. Zubair Shah.
Mm-hmm.
And I came by myself. I was pretty peppy walking in. I'm like, got out of the hospital. I was like, some meds is going to take care of this, going to be back to business. And I didn't show up to our first appointment because I had the dates mixed up. That was on me.
Oh, I bet he loved that.
Yeah, and he was calling around to see if I was still around. He was pretty concerned for me.
Yeah.
And so anyways, he was like, he's really pretty, and he has his own way of doing things. But
Dr. Zubair Shah.
yes.
Yeah, he does.
Anyway, so he told me. He told me.
He's a great guy. He's a great doctor.
He's amazing. He's amazing. He gave me his number. It was really great. So was able to communicate with him anytime. I didn't take advantage of it or abuse it, but.
But he was pretty blunt when he said.
Yeah.
you
He said,
need
bring
to
your wife next time you come in. I'm like, whew.
wow.
It's like your heart's really sick. So yep.
Sally has another question for you, Michael. A lot of questions coming in for you. Do you know anything about your donor?
No, they keep everything relatively private. Yeah.
Uh-huh.
Are you allowed to write a letter? How does that work?
The process is typically at a year. They can. There's sort of a discussion that's had with both sides if they want to connect, and then it usually begins with some kind of correspondence, and then. There's no right or wrong answer with
Sure.
that. It's extremely traumatic for both sides, or potentially could be. So that it's really sort of has to gauge the willingness on both sides to connect. But we at least wait typically a year before that process would even be, for lack of a better term, appropriate.
Till you broach the topic. So that point is coming up. Have you talked about this with Katie, and do you have any thoughts on that?
Yeah, I mean, it's hard to find the words it's hard to find the words, I think it's something that's, that I want to do. Is obviously it's a weird thing, right, to thank them, but it's also, it's just along with my doctors and nurses and everybody I want to thank. And it's just finding the words is hard,
Sure.
But my appreciation is
How do you say thank
my
you
life,
to
yeah,
that?
100%,
Right.
yeah. And I wasn't quite sure. You don't have any more segments of me saying anything, right?
I do. Well, I do have one more that you said about Dr. Zubair Shah. So
Yeah.
he's the fourth doctor that you guys giggle whenever we bring up Dr. Zubair Shah. There's a lot of affection on this team for each other. Dr. Zubair Shah is Michael's primary heart failure cardiologist. Here's what Michael had to say about Dr. Shah.
I had a really good relationship with Dr. Shaw, and he gave me his phone number like at the second session of his personal line to like text him or call him whenever I needed. So it's like, we had a really good relationship. Anyways, after the fact, I ran into him after my transplant, and he was like, he took my heart to like do studies on it to figure out what was what.
And do you have the results of those studies? Any insight?
No, I should text them and ask what it was.
As we wrap up this conversation, I would love it if Katie could bring Rocco back in, because there's nothing better than a cute kid dressed as a dinosaur. So if Katie's out there and she can bring Rocco back in, that would be amazing. Also, I would love some final thoughts from the rest of our doctors. Dr. Shaw, you have a fondness for everyone on this team. Tell me more about the basketball, though. I'd love to know about that challenge.
Great.
Do I give the real version or the
The real version, the unvarnished truth.
I will say, I think the secret sauce of the program is the camaraderie.
Yeah.
We all like to work together. This is a really, really hard job. We take care of really, really sick patients, and if you like the people that you work with, it makes this so much easier to make decisions and feel comfortable with them. So part of that, there's always a little competitive flair, and so us heart failure cardiologists have challenged the cardiothoracic surgeons in games of basketball. The memory of that it depends on who you ask, but on who's winning and who's losing. But I will say it's probably 1-1 right now.
Right. Okay.
They won the first round, we won the second round, and a tiebreaker is probably needed.
Yeah.
Dr. Zorn, okay, have you ever had a patient that's doing so well after their transplant surgery that they want to challenge you to a game of basketball?
This could be the first.
Okay.
Yes.
Will we be invited to the game to see?
As long as you don't film it.
Oh, really? I can't promise that. I can't promise that.
Please, no.
Dr. Danter, what kind of patient is Michael?
Well, I mean, Michael was unfortunate to have a problem that really, he'd done everything to try and mitigate and take care of himself and do all the right things. So he's a model patient in terms of, his understanding of his disease and now what his process is afterwards. And he really is an extremely charming guy. And, we want nothing but to continue to support, his journey through this and everything. But Michael's as model a patient as you could ask for, really. Intelligent, informed,
He jokes with you.
Right.
Gives it to you.
Yeah.
Yeah.
And his way is what's kind of very, well, not kind of, which is very endearing and charming.
Yes.
So that's
I
it's
want
always
to
nice.
acknowledge Katie. Katie, can you just come on in here? I know I'm putting you on the spot, but she has been through thick and thin with Michael, and I can't even imagine what those weeks were like with him. So, cute kid alert. Rocco has landed. He has shed his costume. If we can get a close-up of that cute little face, I would be so, there we go. Look at that little guy. Thank you so much for coming on the show. Thanks, Rocco. And thank you to our doctors. We know you're super busy treating patients, so we appreciate your time. And thank you for joining the conversation as well at home. If you'd like to watch or share any one of our previous episodes, just scan the QR code and it will take you to a link of all of our past episodes. We'll see you right back here tomorrow morning.
Coming up tomorrow on the Morning Medical Update. Two sisters share more than just a family bond. They also share a breast cancer diagnosis. I'm Jessica Lovell on the next Morning Medical Update, the role of genetics in breast cancer, Friday at 8.